what are some of the biggest ongoing concerns for patients with sickle cell disease as we continue to make our way through this ongoing pandemic?
I think, and I talk to a lot of patients, not just my own, but in my role with the FDA, I talk to a lot of patients and community advocates, and there's still an overwhelming sense of fear, fear about the present and being afraid to get COVID-19 infection, being afraid if you're a parent living that has a child with sickle cell disease and you're an essential worker having to go to work and maybe get exposed and bring the infection back home to your child. So there's fear in the present, but I think there's fear about the future and the unknown. When are people going to be able to leave their homes? When are parents going to be able to go back to work and make a living wage? How are we going to get back to normalcy? When are kids living with sickle disease going to be able to go back to school, in-person school? And what accommodations are going to be made? I think there are profound fears. The other issue that we haven't touched upon yet is that people have to remember that the hallmark of sickle cell disease is the sickle cell pain episode or vaso-occlusive pain crisis, something that comes out of nowhere, the most intense pain that these people have ever felt in their lives. And they're still suffering these pain episodes at home, and they're trying their best to manage with whatever pain medication they have at home, but they're struggling. And they're not going to emergency departments the way they used to because they're afraid. So there could be significant, I think, trauma associated with that in the future. Trying to manage a chronic disease for which you would usually get acute medical attention for a complication and feeling like you can't. Patients are they're very scared. But as we all know, sickle cell disease patients are very resilient and very strong. A lot of them are called warriors. And so one of the fantastic things I've seen about the sickle cell patient community is the banding together. They are using social media platforms, to practice social connection with physical distancing. So they are banding together to be a support to one another from their homes. And I think that is one of the most important mechanisms that's helping the whole community get through this crisis.
Okay, thank you for that. And yet it seems that fear is a really overriding factor across many different patient populations. And it seems that fear of seeking what most people would consider proper medical attention for certain
Mhm.
types of episodes is something that happens across multiple conditions now. That being said, what are some of the most pressing questions that you have surrounding the interaction between sickle cell and COVID-19 that you would like to see answered going forward?
Well, I think that we still want to know if individuals with sickle cell disease are at as high risk for complications from COVID-19 as we suspect. We still don't know. So we're operating under the assumption that this is a very high risk group. And that's why we're putting all of those protective measures and recommendations in place. Um, I think that's a major question and probably the largest question. And then we have, sort of the general questions about how long is once exposed, how long is the immunity protective? Would there be anything about having sickle cell disease that would make the likelihood of a long-lasting immunity less than the general population? Are there going to be specific concerns about protective immunity in sickle cell patients? These are just some of the questions that we have. Um, you know, uh, it's hard to sort of think much beyond today. I think for most of us in the world right now. But in the future, these are going to be the questions we'll have to address, and the fact that we are going to have to see patients face to face. We do a physical examination for a reason because it helps us take care of patients. And that's something that we can't do from a distance. So we're going to have to figure out as a medical community how we can implement safer care with appropriate physical distancing. Most of our clinics and waiting rooms and emergency departments are crowded. So how are we going to make the ability for patients to get routine care that has nothing to do with COVID-19 infection in a safe way?